Hi, I'm Matt Norris, student physical therapist at Campbell University. Today I'll be demonstrating the moving valgus stress test, which assesses for integrity of the medial collateral or ulnar collateral ligament of the elbow. Assessment of the medial collateral ligament is important as the anterior and posterior fibers are the main prevention of extreme valgus at the elbow. Although acute, complete tears can be very straightforward to diagnose, partial tears and ligament attenuation are also quite challenging. The MCL of the elbow is most commonly injured among throwing athletes, but also can be affected in industrial workers who repetitively perform overhead motions. The stability of the MCL is comprised of three fiber bundles, the anterior, posterior, and transverse. The anterior fibers attach from the medial epicondyle of the humerus to the coronoid process of the ulna. The posterior fibers attach on the medial epicondyle of the olecranon to the medial epicondyle. The transverse fibers attach from the coronoid process of the ulna to the olecranon. Between full extension and 20 degrees of flexion, the bony block of the humeral ulnar joint is responsible for resisting valgus forces. Beyond 20 degrees of flexion, however, the primary restraint against valgus forces is the anterior fibers of the medial collateral ligament. Placing the elbow into abduction and full external rotation allows the anterior band of the MCL to become fully stressed when a valgus force is applied. According to research by O'Driscoll et al., the moving valgus stress test demonstrates high sensitivity of 100% and specificity of 75% when compared to assessment of the MCL by surgical exploration or arthroscopic valgus stress testing. The painful arc where the pain is produced most maximally with the moving valgus stress test is between 120 degrees of flexion and 70 degrees of extension at the elbow. The moving valgus stress test is an accurate physical exam technique when performed and interpreted correctly is highly sensitive for medial elbow pain arising from the medial collateral ligament. When performing this test, you're going to have your patient seated or standing. We're going to do it seated today. You're just going to have them bring their arm to 90 degrees of abduction. Have them sitting up straight. Stabilize the arm at the distal humerus and distal forearm. You're going to provide a moderate valgus force while concurrently fully externally rotating the arm. You okay there? Mm-hmm. And then you'll just forcibly extend the elbow down. Okay. So for this test to be considered positive, it is dependent on two factors. The patient must experience pain at the medial elbow during the forcible extension. The next factor is maximum amount of pain should be experienced between 120 degrees of flexion and 70 degrees of elbow extension. The patient can experience pain throughout this range, although the intensity should be maximally between the 120 degrees cocking phase and the early acceleration phase, or the 70 degree range. So now I'm just going to demonstrate a clinical scenario to my patient here. Hi, Ramin.
Hello.
How you doing?
Good. How about you?
So I know you've been having some pain with your elbow from all the throwing you've been doing. So now I'm just going to check it out. Which one's bothering you?
This one's the one that's been bothering me.
So your left. So I'm just going to check your right out first for a baseline, kind of let you know what we're going to do and make sure everything feels okay.
Okay.
So I just want you just to relax.
Okay.
This shouldn't be a big pain or anything. Just there. Okay there?
Yep.
Okay. I'm just going to check your affected side.
Okay.
Okay?
Mm-hmm.
How's that feel?
A little painful right in the middle.
Okay. This has been a demonstration of the moving valgus stress test.